Thank you for joining me. My name is Anil Tailor. I'm a consultant gynecologist and I practice in the UK. In this short video, I want to talk about whether having abnormal smears or having a colposcopy examination or whether having treatment such as loop biopsy of the cervix, whether these have the potential to affect future fertility or the potential to affect future pregnancies and how they would behave. So I have already created quite a few other videos, short videos on specific topics such as what abnormal smears mean, what a colposcopy test involves, how are abnormal smears generally treated, what does a loop biopsy actually involve. All these are already uploaded, and please search them out because they will help you understand what I say in this video and in more context. So smears themselves, having abnormal smears, can they affect future fertility? Now, abnormal smears are obviously in the UK graded into 4 abnormalities: the borderline, mild, moderate, severe, and the borderline and the mild are the low grade, and the moderate and the severe are the high grade. Now, abnormal smears in themselves do not affect fertility, nor do they affect how future pregnancies may behave. What I mean by that is whether there is an increased risk of miscarriages or preterm labor. So generally speaking, having an abnormal smear will not affect fertility or the way future pregnancies will behave. Now, let's consider the commonest reason for developing abnormal smears. So that is, of course, the HPV virus. And it's a very, very common virus. A majority of women by the age of 25 have acquired it, and most women, their immune system will get rid of it, and the woman will not even develop any abnormal cell changes. In some women, the HPV virus persists, and that can then cause some cell changes on the cervix. But what we do know is that HPV virus itself does not affect fertility, nor does it affect how future pregnancies would behave. However, if one considers when the HPV was first acquired by any woman, if any other infections were picked up, the main one here being chlamydia, then that can affect fertility, because what we know about chlamydia is that it's very common, and it can affect the tubes and cause blockage of the tubes. Now, if it causes blockage of the tubes, then that will mean that the sperm can't meet the egg, and therefore fertilization can't happen, and that is the mechanism behind the infertility. So the HPV virus itself does not cause these problems, but if there were any other infections picked up at the same time, such as chlamydia, then they certainly can cause infertility. What about the colposcopy test itself? Does that have any detrimental effect? And the answer to that is no. It is perfectly safe. It's a test that takes about 5 minutes. Yes, during the examination, the cervix will be sort of cleaned with mild vinegar solution, acetic acid. That would be to clear away the mucus, but it also show up the abnormal precancerous areas. But that in itself does not increase the chance of infertility. And indeed, even during pregnancy, we can safely perform colposcopic examination, and it does not cause any problems with the fetus. So colposcopy examination is safe and it does not cause problems with the pregnancy. What about loop biopsy? So the loop biopsy is a procedure that is very commonly performed, especially in the UK, to treat high-grade abnormal smears. So in a loop biopsy, a little bit of local anesthetic is put into the cervix, and using a very thin wire, a loop of wire, and using a special electric current passed through that wire, we are able to scoop away a tiny portion of the cervix, the portion that contains the abnormal cells, and leaving behind a tiny crater. Now, most gynecologists in this country would, when they do the loop biopsy, would carry out a very shallow, because it's only the superficial surface area that needs to be scooped away. And what research has shown is that when it is kept shallow, meaning usually less than 10 millimeters in depth, then it doesn't cause any significant problems in pregnancy, such as miscarriages. And it certainly does not affect fertility. So having a loop biopsy does not affect future fertility, meaning your ability to fall pregnant is not affected. So the debate is whether having a loop biopsy affects how pregnancies will behave. Now, what research is showing is that early miscarriages, meaning miscarriage in the first 12 weeks, they are not affected by having a loop biopsy. How about the middle of pregnancy, meaning what we call the second trimester? Now, research is seeming to suggest that having a loop biopsy can increase the risk of having what we call late miscarriages. However, let's put this into context. Late miscarriages are in themselves rare. So most miscarriages, if they are going to happen, usually happen in the first trimester. They are very common. And they are not affected by loop biopsy. Once the pregnancy establishes itself and you enter the second trimester, miscarriages at that point are not common. And so estimate probably 0.5% of pregnancies would end up with a miscarriage in the second trimester. And what research seems to suggest is that perhaps that is increased by 2 or 3 times. So meaning, say, about 1.5% compared to 0.5%. So that risk of miscarriage is still very low. And furthermore, the research is seeming to suggest that it's when the loop biopsy was fairly chunky, meaning fairly deep, that's when it seems to cause a problem. So most women who have loop biopsies will not have any problems with excess miscarriages in their pregnancies. What about preterm labor? Again, research is seeming to suggest that women who have loop biopsies may be at a slightly increased risk of having preterm deliveries. There is also some debate as to some women in whom there is excessive scarring in the cervix, whether that in itself delays the progress of early labor because of the scarring in the cervix. So these are some of the things that is debated, but on the whole, it should not stop you from having a loop biopsy if that is what is required to treat your abnormal smear. Now, in the old days, before loop biopsies became common, we used to do a lot of much more aggressive biopsies called knife-gone biopsies. Now, they are rarely performed in the UK these days. And yes, they as I said, were much more aggressive and certainly did cause problems in pregnancies. Didn't necessarily affect fertility, but certainly did cause problems in pregnancies. But that is now rarely performed in the UK. Now, because of this risk of miscarriage with loop biopsy, you will understand why some women who present with low-grade smears are not necessarily treated. It's only the high-grade smear abnormalities that are treated with loop biopsies. So the low-grade smear abnormalities are usually left alone and monitored because there is a good chance that in those women the immune system will get rid of the problem by itself. And that is the reason why we try not to interfere in women with low-grade abnormalities. I know it can be frustrating for some women to keep coming to the colposcopy clinic to have themselves checked out, and some of them just wonder, well, why can't they just have the treatment and just get rid of it? The reason that we try not to interfere with the cervix is because it does have slight effect in terms of future pregnancies. So that is all I'm going to say about on this topic. I have created quite a lot of other videos which have been uploaded. Please search them out. There are many on similar topics, but also on other topics as well. So by all means, search them out. And if you find these videos helpful, then please consider subscribing or clicking the like button. Thank you for watching, and until next time, stay safe.